Attention. We have a collision involving a child approximately 5 years old. Eastbound Lansdowne at Monaghan. Requesting immediate response. Phil, what you'll discover at the scene is that the child has been dragged underneath the vehicle and remained conscious the whole time. She'll ask, "Am I going to die?" You'll need to assure her she won't.
Post-traumatic stress disorder, or PTSD, is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. While combat veterans often suffer from PTSD, the condition is also experienced by victims of sexual assault, domestic violence, and childhood neglect and abuse. PTSD affects approximately 5% of the general population, but is far more common among women. With respect to different groups and demographics, teenagers aged 14 to 18 in foster care homes were found to have one of the highest rates of PTSD, and the rates are even higher for those that experience sexual or physical abuse. Urban youth populations are another group at risk of developing PTSD due to their socioeconomic instability as well as their potential for experiencing interpersonal violence. So what causes post-traumatic stress disorder? PTSD is caused by the experience of a traumatic event. These traumatic events can lead to an alteration in the brain's response to stress and can change the level of certain molecules in the brain, causing the previously described symptoms. Events such as these typically involve death or threatened death, actual or threatened injury, or sexual violence. Victims often feel intense fear, helplessness, or horror during the event. According to the Diagnostic and Statistical Manual of Mental Disorders, which is a publication often used to diagnose and classify mental illnesses, a variety of criteria must be met for a PTSD diagnosis. Some of these criteria include the presence of a traumatic event, re-experience of the traumatic event, for example through nightmares or flashbacks, and avoidance of stimuli related to the event.